Hey everyone, welcome to episode 87 of ADHD Superpower. Today's topic is on ADHD and cognitive behavioral therapy, or CBT. CBT can be an effective treatment for adults with attention hyperactive disorder. CBT is a type of talk therapy that can help people with ADHD manage the symptoms and improve the quality of life. CBT for ADHD can help with executive function, emotional regulation, impulse control, as well as rejection-sensitive dysphoria. CBT can be used in combination with medications or on its own. CBT sessions can include teaching people cognitive and emotional strategies, and the number of sessions can range from 6 to 14. The goal of CBT is to help people with ADHD develop coping strategies that they can use in their daily lives. CBT can be challenging, and change may happen gradually. However, many people find CBT to be helpful, especially when delivered by a therapist who understands ADHD and you. So what is CBT exactly? After a lifetime of mistakes, like me, missed deadlines, is any wonder that adults with attention deficit disorder suffer dangerously low self-esteem, some of them, and perpetually negative thoughts, some of them. CBT is a short-term, goal-oriented form of psychotherapy that aims to change these negative patterns of thinking and change the way the patient feels about him or herself. CBT aims to change irrational thoughts patterns that prevent individuals from staying on task or getting things done. For individual with ADHD who thinks this has to be perfect or it's not good, or I never do anything right, CBT challenges the truth of these cognitions, changing distorted thoughts and resulting change in behavior patterns. It's effective in treating anxiety and other emotional problems. So how does CBT help people with ADHD? ADHD is chronic persistence delay, emotional dysregulation, impulsivity, blah, 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 blah. Individuals who grow up with ADHD encounter more frequent and frustrating setbacks in life situations, on the job, in social interaction, everyday organization. Because of these many setbacks, adults with ADHD become self-critical and pessimistic. This, in turn, sometimes causes them to experience negative emotions, cognitive distortions, and unhealthy self-beliefs. It is common for individuals living with ADHD to think that they are at fault when situations don't turn out well, when in many cases they aren't. They may bring some of the pessimism to the future, imagining that tomorrow will go as badly as today. Demoralizing thoughts and beliefs that keep individuals from doing what they want to do actually can't stand up to the light of logic. As CBT reveals, these thought processes are distorted in certain characteristic ways. So, it's all or nothing thinking, overgeneralization, mind reading, fortune telling, magnification of minimalization, should statement. You focus on how things should be, leading to severe self-criticism as well as feeling of resentment toward others. Personalization. You blame yourself for negative events and downplay the responsibility of others. Mental filtering. You see only the negative aspect of our experience. Emotional reasoning. You assume that your negative feeling reflects reality. Feeling bad about your job means I'm doing badly and will probably get fired. Comparative thinking. You measure yourself against others and feel inferior, even though the comparison may be unrealistic. Learning to recognize these distorted thoughts help you to replace them with realistic thinking. Lastly, researchers from Harvard Medical School wrote, the conceptual and empirical basis for CBT approaches in adult ADHD is growing and suggests that targeted, skill-based intervention have a role in effectively treating this disorder. At this stage of development, however, subsequent study must progress in terms of methodological rigor. Additional randomized controlled trials with active control group are needed, and intervention packages must be tested across multiple trials by more than one research group. Thank you guys for this. I know it's a little difficult to grasp. If you have to, listen to it again, or just look up CBT and talk to your psychiatrist or physicians about it. Thank you. Bye.